The American Board of Internal Medicine is the largest member board, and so we have the largest amount of society partners. And it's been very important to us to maintain those positive relationships and find ways to work together to benefit our diplomates and society members.
The Pediatric Readiness Quality Collaborative at Comer Children's Hospitals is working with societies. The collaborative was formed by a joint venture by the American Academy of Pediatrics and Emergency Medicine for Children. What we're doing is working together by implementing their guidelines at our facility and other facilities throughout the state.
The American Board of Internal Medicine has been working closely with the American Society of Clinical Oncology to develop a maintenance pathway through our own assessments, taking our knowledge check-in, but really creating specialization within that. So in 2020, there will be 3 opportunities: breast cancer, hematologic malignancies, and general oncology that diplomates can choose from to meet their assessment requirement.
We were able to address abnormal vitals for our patients prior to them being discharged. We were also able to address, for the providers, an alert system that they were able to see in case there was a missing vital or there was an abnormal vital that they hadn't had a chance to address prior to discharge.
Some of the best practices for engaging in collaborative maintenance partnerships with our society partners have been really communicating together effectively, owning each other's problems, keeping our populations informed of the changes that are coming, to ensure that we have a pathway that benefits both our diplomates as well as our organizations.
The societies, the providers, and the boards were able to work together with this project by the providers identifying a need, the society building the clinical care guideline for those needs, then the providers implementing that guideline, and lastly, because it's a multi-specialty project, the boards were able to give maintenance and certification credit for that quality improvement initiative.